Good afternoon, everyone, and thank you for participating in today's webinar on social media for the physician practice. My name is Veronica Posada, and I'm with Physician Partners and the Physician Resource Center. I hope that everyone can hear me. If not, please type in the chat tab that there's some issues with the audio. So our presenter today is Christina Thielst with National University. Christina has experienced the evolution of the healthcare system over the last 30 years as both a hospital administrator and consultant. She has a widely syndicated weblog, Christina's Considerations, that has also been added to the National Library of Medicine's collection and archive of medicine and public health blogs. She has a master's in health administration from Tulane University, School of Public Health and Tropical Medicine, and is a fellow in the American College of Healthcare Executives. I'd like to start off with sharing a few poll questions with everyone. If you can please take a moment to read the poll question and answer it, we'd appreciate it. So I will launch the first question here. A few more seconds there and we'll move on to the second question. Here's the second question for you. A few more seconds there and we'll move into the third question. Okay, we'll close that. And I want to let everyone know that you are in mute status, so at any point that you have any questions, please feel free to type in your questions on the side panel there, and we will address all questions at the end of the presentation. And I would like to hand it off to Christina.
Thank you. Thanks for having me. So I wanted to give you a little bit more information about where this actual presentation comes from or what it came out of. So back in 2005, I started my blog and couldn't help after I had been having it a few months and watching social media, Twitter and Facebook and other sites sort of evolve, wondering how these tools could be used in healthcare settings. And so since a little after starting my blog, I've really been thinking about social media and the use of it in, at first primarily hospitals, but then over time I've started really watching how physicians use it and other kinds of healthcare organizations. Being that my background is in administration, I often am concerned about risk, privacy, other kinds of legal issues. So one of the things that I did a few years for the American College of Healthcare Executives was write a book that addressed those kinds of issues, how to plan a social media strategy that was something that would benefit the business of healthcare, whether a hospital or a physician practice, but at the same time manage those risks that I was seeing with social media being used by professionals. And then the latest work that I've been doing has been really looking at the underlying technology and how those can be used for population health and more clinical management of patients. So there's a lot of potential in social media and the technologies, and hopefully you'll enjoy this presentation that is really sort of the starting point for it all. So why are we actually having this conversation today? And it comes down to social media is here, just as email is here and fax machines are here and phones are here. It's another communication tool. It's not going anywhere. It's very easily accessible, and our patients are using it on a routine and increasing basis, and they're sharing their experience with the world. So this was a tweet I picked up a couple of years ago. I thought it was particularly interesting, but our patients are live tweeting their experience in our facilities. And can I ask at this point the results of the poll? Because I don't see them on my screen.
Oh, yes. They will be shared at the end of the presentation.
Okay.
But if you'd like, I mean, I can launch them now.
No, that's okay. I can do it at the end. All right.
Okay.
So what are patients sharing? I had a client a couple of years ago, and one of the things that I did while I was waiting in their lobby, waiting for my appointment to begin to start the process, was I went on to Foursquare and Yelp to see what their patients had to say about the physicians in their practice. And this is just a little list of some of the ones that I found. There were others. Some are positive, you know, Dr. X is a miracle worker, but others highlight some of the feedback that it's important to both the physicians and administrators in their practices, things that are opportunities for them to improve. The YouTube video of staff brushing their hair is something that a CEO of a hospital mentioned to me once. I guess his emergency room clerks were in the area where the clerks hang out and help patients. They were brushing each other's hair. Unfortunately, the patients didn't know that they had both already punched out and weren't really supposed to be there. But one of the patients that was waiting in the waiting room took a YouTube video of them and posted it and mentioned her frustration about how there are sick people in the waiting room waiting to be cared for, yet the staff are too busy to assist them because they're brushing their hair. This is a nice cartoon, kind of reinforces the same thing. It's not just about the patients being able to post content about their experience in their physician's office, but the fact that they're posting this information online presents an opportunity for physicians and their office staff to find where their patients are posting and listen to what patients are having to say, and taking that information and using it to improve their services. And in this case, perhaps the physician has changed his preferred lunch so that his breath isn't smelling like salami any longer. And so here we'll go through some of the different social media channels and talk about specific ways that a physician practice can use these different tools. So the first thing I think that any physician should do is go to Yelp and look and see what patients or others are saying about your practice. There you'll find good things, hopefully, but you may also find things that are negative. You may find things that are unfounded. And what you'll want to do is manage your reputation. The best way to manage your reputation is to let people who are posting know that you're listening. If they know that you're listening, they may be a little bit more likely to post more honest feedback and sort of temper some of the negativity that they have. I don't recommend that anyone go on and counter points that patients are making. Instead, provide them with a phone number or a contact name or someone that they can call and contact and share more information so that you can respond on an individual basis. But another side of it is also that your current patients who have really good experiences, it doesn't hurt to encourage them to go online and share those experiences as well, because oftentimes as someone who does periodically look to see what Yelp has to say about a restaurant, I'll look to see what the good and the bad is, and sometimes when I see that there's more good than bad, I may discount a little bit some of the bad, because we're all not perfect. LinkedIn is another social channel that I think it would be important for healthcare providers to use. It's a way of definitely connecting with other professions, especially those maybe in your particular field or with similar interests. There is a little bit of a concern of being friends with patients. I think it's something that each individual practitioner would need to consider thoughtfully and make a decision on, and then at that point be pretty consistent about whether or not you separate who your friends are on LinkedIn with whether or not they include patients. There are also, I think at a minimum, you would be well served to create a company page. This is just an easy way for people to find your business on LinkedIn, which is heavily trafficked by professionals and business people. There are opportunities to add content, add posts, share your area of expertise with individuals who may be referrals or referral sources for your practice. And it's also a great place to post job opportunities. More and more professionals are turning to LinkedIn to look for jobs. There's a special jobs button where you can push, and it will automatically share job opportunities in your geographic area. But you can also search it as well. So it's a great way of putting your job postings out there and finding people who are communicating on a professional site. And another one that I think is good, especially if you've got any interest in research or a more public persona, want to get ideas, writings, research, that kind of thing out in to a broader audience. Twitter is a really great way to do that. One of the first things I recommend that anyone do if they have any interest in using it is to select their preferred domain name. Once a name is used, then no one else can have that same name. Search on keywords. So searching on keywords is a great way of finding information, even if you never send a tweet yourself. It's a way that you can search for information in your area of interest. So for instance, if you're interested in cancer or a specific type of cancer, you can enter search on that. It will show any tweet that mentions cancer, and it's a great way of finding what others are having to say about it, new articles that are coming out on the topic, any research that's coming out on the topic. Short, simple messages. So the thing about Twitter is it does require you to be short and succinct. You're limited to 140 characters, but that's okay once you get practiced with it a little bit. It's not too difficult to do. But remember, when you're using those short terms, that you're focusing in on the keywords. So save your characters for those most important keywords, because again, when people search on those keywords, that's what they're going to be looking for. And then using hashtags. So hashtags, if you've been on a lot of social sites lately, you're seeing more and more of those. Again, it's another way of tagging these posts so that they're a little bit more easy to search for. So for instance, one hashtag that I use often is healthcare social media, and it's hashtag HCSM Another one is for patient experience, so anything that has to do with patient experience, that hashtag is hashtag PTEXP. And then Facebook. So Facebook is, for me personally, something I use to connect with my personal families and friends, and then professionally I use LinkedIn to connect. However, some physician practices may find that they're wanting to have a Facebook presence to connect with their patient population. Perhaps pediatricians would feel comfortable connecting with their patients in this way, their adolescent patients. It's something to consider, and it's also something to be careful how you set it up as far as privacy and who you mix in with your friends. So again, if this is going to be a Facebook page for your professional practice, it probably isn't a good idea to have family and friends also on that page, unless you are pretty confident that what they're sharing would put your practice in a positive light. Again, on Facebook, you can also set up company pages, highlight your practice, what you're doing, what sets you apart from others in your same specialty. Again, continually build upon that audience. It's a great pool of people who are interested in your organization so that you can share updates and events and things that are going on in the practice and keep people informed. There is opportunities these days for advertising on Facebook, but I would pursue this cautiously. One of the things that Facebook is doing is they're advertising. There's a cost to it, and the formulas seem to change on a fairly frequent basis. So before you start advertising on it, making sure that you understand what your return on that investment is going to be. Is it a click? One thing that they don't like is a link to some other site. They are trying to keep people who are clicking within Facebook. So there's a lot to consider with advertising on Facebook, but more and more healthcare organizations are using it as a tool. And then a couple of other sites that I think are worth mentioning. The first is Wikipedia, and I think the reputation of Wikipedia is that it's not accurate, and there are times when it's not, but for the most part, it's not too far off. There are a number of people who monitor Wikipedia articles, and if they see anything that's incorrect, they make changes. So, you know, there is some oversight to Wikipedia, but one of the things that I do recommend to healthcare organizations is that they check to see if there's already a wiki article about your practice or about your hospital, and if so, who created it, what information is being shared, and is that information that puts the practice or the hospital in the light that they would like to be in, or is it negative information? So if it's negative, you know, how can you go and revise that content so that it is a little bit more reflective of your organization and values? It's also a great way, again, if you're doing any kind of research, to share your articles, promote your expertise, you know, any kind of content that would be of value to the general public. When the search engines, when you Google a term, most often the social sites or content that's in those social sites will pop up first. So this is a way that when people are Googling a particular topic, if you have a pretty well thought out Wikipedia article on some subject, then it's most likely that that will wind up at the top of the search results when someone Googles that topic. And then Pinterest is another interesting social site, and this is one that perhaps in the area of dermatology or other specialties where visuals are important, it may be a way of sharing some of that. I have a Pinterest account, and one thing that I do is I like to collect healthcare infographics. So all of those infographics that we see in our trade magazines that look at some aspect of healthcare. I like especially patient educational materials that are graphically conveying information to patients versus us handing them a lot of text. I save all of those that I come across on Pinterest. So it's a place that perhaps if you have education or teaching materials, visuals that you routinely want to share with your patients or feel like it's something that should be easily accessible and available to them, it may be appropriate to have a Pinterest account, and then you can refer your patients there to access that information. And then that's the end of the slides that I had prepared. So at this point, I can answer any questions that you might have.
I'm so sorry. I've been on mute this whole time talking to myself. I apologize. So we do have a question here. The question is, I am really confused about how to use Twitter. Can you give a real-world example of how to use it?
So I'll give you a couple of examples of how I like to use it. So I receive, Modern Healthcare and other magazines, and in some of those magazines I'll come across articles that I really find interesting or of value, or perhaps maybe I don't quite know what to do with it today, but in a few weeks I might actually have a need for that. And so I will usually tweet those articles. So if it's a paper form of the magazine, I'll Google it, look for it online, and then tweet it. And that way, a week from now or 2 weeks from now, when I go, you know what, I need that bit of information, I have a way of going back and finding that tweet and getting a link to that article. Sometimes I'll get newsletters on my email. It's the same thing. I'll read an article, and again, maybe I'm not quite sure what I might need that for, but I'll tweet it just so it's in my feed, and I can always reference back to it later. It takes a couple of seconds to do, but it saves a lot of time if I'm trying to find something a couple of weeks down the road. Another thing that I do is when I do go to a conference and I hear what I call pearls of wisdom, where speakers are sharing things that sort of really connect with what I'm interested in and what I'm thinking about, I'll tweet those pearls of wisdom as well. And again, it's a way for me to, at the end of the week, when I get back and I want to look back at what I heard, who said it, I can look at those tweets and maybe track back and make contact with individuals who had something really useful to say and reach out to them and ask questions. So for me, Twitter is a lot of times about keeping information, electronic, digital information, organized. My blog is certainly, that was one of the two main reasons that I started it. It's a journal, and it's another way of organizing all of this digital information that's out on the website.
Okay, we have another question. If the doctor and his or her staff do not want to respond to patient questions or interact with patients, how would we set up a Facebook page for the practice?
Well, you can set up a Facebook page and also have a place where you put that comment, whether you put it into a graphic and then upload that graphic as your, photos, or the banner across the top, where you can include that comment that, this is a place for sharing information, but we're not going to respond to clinical questions, and then direct them, if they do have a clinical question, how to reach the office. So it's a matter of just sort of setting up those rules of engagement and communicating them on the site. Same for Twitter. You can have a Twitter account. At the top there's a little description. You can just describe the practice briefly, and then put a comment that we won't respond to clinical questions on this site. Now, sometimes providers will have a tweet up and actually have an opportunity over an hour period of time, let's say, where they do respond to questions that patients have. Some providers who are doing that feel those are very positive. They don't go into specifics about individual patients, but perhaps maybe talk about immunizations and what the current research says about immunization, dispel myths. So you're answering clinical questions, but they're not about a particular patient.
Okay, another question is, why is it that positive reviews don't often show up on Yelp?
I haven't heard that positive reviews aren't always showing up on Yelp. I know that there's ways, if you pay for the premium membership, you can hide negative ones, but I hadn't heard that the positive ones are not showing up.
Another question. I do a lot of patient education. The Pinterest is a good idea, but I can see people getting lost. Any other ideas to help the patients within our website to get the info, or you think patients will really find Pinterest useful?
Well, some, and I think younger patients. So if you have a younger population, Pinterest is probably a better fit. Like, not all social channels are good for different patient populations, so it kind of depends upon your use. If you're interested in really having something tied to your website, there's usually widgets that you can incorporate into your website so that patients can see that information from your website or launch into it from your website. Another thing you could do is also, if graphics are easily put into weblogs, and a lot of the website platforms also typically offer these days a weblog component as well. So it'd be very easy to activate that weblog and also share those images there as well, if you're trying to keep people within your site.
Okay, we have two questions here from the same person. Are there local consultant or technicians that can help us set up Facebook or to help with SEO? And then the second question, are there liability issues that we need to be aware of with respect to the accuracy of the information?
Well, it would depend. The liability on accuracy of information. What I tweet or put on LinkedIn to share with my colleagues typically comes from places that I trust, so sites that I trust, organizations that I trust. I don't tweet things that I'm not real sure about. So I would think from a physician tweeting something from the American Academy of Family Practitioners, as long as it's something that's it's a trusting organization. I don't think that there's any additional liability over perhaps handing a patient an article that you might find on their specific condition in a publication. So my recommendation would be to really only share information that you feel comes from legitimate sources.
Okay. Do you, let's see here. On Facebook, patients find my personal one, and to be friends, I often decline, but worry if I upset the patient. Remind me, does Facebook send the declination? Yeah.
I don't think it sends it doesn't say that you've declined, but sooner or later people figure out that you haven't accepted their request. And they may, I know I get this on LinkedIn. I only connect with people on LinkedIn that I know. What I will do is send them a message saying, I don't know you, but it seems like we have some things in common. Why don't we schedule a call? And maybe there's a way of following up with patients at their next appointment, making a little note that they wanted to be friends on Facebook, and then at the next appointment say, this is really, Facebook for me is a way of staying in touch with my family and close friends, and as a policy, I don't, connect with people who are my patients. And I think just explaining that to patients will go a long way. Or, maybe even a little sign in the office somewhere that, if you are getting a lot of patients wanting to be your friend on Facebook, that you just have something that shares that, it's used more personally and not for connecting with patients, but then also give them an opportunity to connect with you somewhere else if that's appropriate. And that's where that company page would come in handy. They could follow you on your Facebook company page. They would not have access to your personal friends and connections, and then you could communicate with them there.
Okay, we have time for one more question, and then we can jump into the poll results. The concern about liability has more to do with information that a patient might put on a physician's Facebook page. For example, if a patient posts on the Facebook page that all immunizations cause autism, don't immunize.
So I'm not sure if I understand the question, but I know that kind of stuff happens. And again, if I had a patient post that on my Facebook page, I would encourage that person to contact the office. There is a way of deleting comments that are inappropriate, immoral, illegal, harassing. I mean, there are inappropriate posts that need to come down. And I would say that, something that is completely wrong would be fair game for the office taking it down if someone left that comment. So a lot of times when you'll see those comments, though, you'll have other patients actually comment that that's not true. They've had all of their children vaccinated. I mean, there'll be a conversation that goes on, but as there's always the option of taking it down, although it's recommended that you not take everything that's sort of negative down, because then, people want to have engaging debate, and if you take everything negative down, then there's not a whole lot of engaging going on. And I think I missed one of the earlier questions about the local resources. There are resources, in every community to assist with social media. I would just be a little bit careful because, again, in the healthcare world, things are a little bit different. We have much more at risk at stake, and so it's real important to make sure that the use of social media is well thought out, and that there's a great strategy and plan.
Thank you, Christina. So I'm going to share the first poll question here. Do you have social media accounts for your practice? It looks like 75% of our audience said yes, and 25% said no.
Okay, that's a good. That's a good starting point.
Second question. Do you use your social media accounts? 67% said yes, and 33% said no.
And so my guess is that the ones who have it but haven't used it are still trying to figure out what exactly they're going to do with it. So, I would, and I don't want to be self-serving, but I do have the 2 books out that talk about social media, and so I would do some reading. You can certainly, there are a lot of blogs. Google specific questions you have, topics. You can always email me if you have any specific questions. There are ways to do it correctly, and there are a lot of resources out there to help people.
And our last question was, do you check Yelp or other social channels for feedback on your practice? And 100% said yes.
Oh, very good. Really pleased to hear that. That's really good.
Well, I'd like to thank our audience for participating today in the webinar. Christina, thank you very much for the presentation. It looks like by the questions, a lot of our audience felt this information useful. And the PowerPoint will be emailed to everybody tomorrow, and a recording of this webinar will be posted on the Physician Resource Center learning site in the next week and a half. Thank you very much.
Thank you for having me.
Bye-bye.
Bye-bye.